Hi there. This video is intended to give you an idea of what a first visit with me would look like if you ever choose to come on in here. So I'm Dr. Jess Barr, Desbrow. I'm a chiropractor, and a typical first visit with me lasts about an hour. Here we are in my office. It's part of my home. You actually come up to the back door of my home and come on in. It's a really nice, safe, quiet environment. And so once you came in, I would have you take a few minutes to fill out some paperwork, kind of a typical first doctor visit. But this is an excellent opportunity to just be able to fill me in of all the things of your life, even though maybe you're coming in for a hip or an ankle or a shoulder or a headache or whatever type of problem. You get to fill in the gaps of any past injuries or illnesses or other aches and pains or how you're sleeping and so on and so forth, because it's all really important to me. From there, we would just get to sit down and have a chat. Some folks, we end up chatting 10 minutes and they've got a pretty simple story, and some folks it's maybe 20 minutes, 30 minutes, even 40 minutes of really digging out the root of the problem. It's definitely a bit of detective work in chiropractic, as we're really focused on treating the cause of the problem, not just trying to put band-aids on all the symptoms. So from there, we kind of establish what your goals are and move into an exam. A physical exam basically checks you from the top of your head to the bottom of your toes, and even if you are coming in with, say, it's something in your hip, I'm going to want to know about everything from how your jaw is moving to how your ankles and toes are moving out to your fingertips, because it's really all connected. And don't let anyone ever tell you otherwise, because it's amazing how just a little bit something here might be changing how your gait is and affecting things on down the way. As we do an exam, I'll be telling you what I find as I find it. So it's also a really neat time to be like, oh wow, yeah, I guess I never noticed, but I do think I have a little bit higher right shoulder, or you're right, I have noticed that when I walk on that foot, that ankle does feel a little tighter, or yeah, that's always the one that I seem to sprain. So we pick up on all these subtleties of your body. And then from there, I move into doing a little treatment. So we go over to this table, and this is great for all sorts of folks, whether they're short or tall or little people or big people. It goes up and down, and it also allows for pregnancy. Even up to 9 months pregnant, women can get comfortable in here by having a good space for their belly and get to lay on their faces, which is a total joy when you haven't been able to do that for so many months. So after we agree on what we want to work on and folks are comfortable, I just work on all those parts, whether it's up here, working on their neck, middle of their back, down to their feet. And some people come in with sort of a notion of, I know that I want to see a chiropractor and I want to get things moving and hear pops and cracks and all that kind of stuff. And I can do that. And some people say, oh my God, chiropractic scares me to death and I don't want to hear anything pops or cracks. And I can do that too. There's a variety of ways of modifying techniques to make things gentle, and most importantly to make sure that people are comfortable enough to be able to benefit from the care. As we wrap up, most folks end up getting some sort of advice or type of stretching or strengthening ideas to help them hold what we did in the work in our session. Mostly what I try to do is impart people with the information so they can just take care of themselves on a daily basis. Maybe it's a little bit of lifestyle changes, posture, nutrition, and above all else, it is the most important to me to help people get better fast, to reach their goals quickly and treat them the same way I like to be treated as a patient. Like, I want to go in and get out. I don't want to be treated for years and years and years. So I always extend that same courtesy to my patients. So hopefully I'll get to see you soon. Thanks.